In a community environment, your traditional medicine has to change. It's got to be like a piece of a puzzle. It's got to fit the community.
Here is this group of people that lives here and works here and wants to give back and believes in this community.
So it's very important to have programs that are really rooted in the communities where people already feel comfortable, places people already call home.
It's just like this wonderful safe haven, and it just makes them feel so much better.
I think in healthcare today we all need to get back to our community roots. I think that if you reflect on why hospitals or health systems were created, it was always to bring more value to the community. And I think over the past several years, as healthcare organizations have gotten larger and somewhat more corporate, we've kind of lost our way in some respects. And I think the more we get back to those community roots, the better off we're going to be.
The AIM High program works to reduce health disparities, particularly for African Americans. Of the 8,000 people who have been screened, nearly 40% have tested positive for either diabetes or hypertension.
I always considered it the program that saved my life, or saved my limbs, because when I was diagnosed with diabetes, well, as a man, I was not a person that went to the doctor a lot. When I started getting diabetes education, especially through the AIM High program, and it just changed my whole outlook on life.
It's one thing to give people the information, it's a whole other thing to help them feel that they can use that information to make some changes in their life, and that's the step we're really trying to accomplish.
The Detroit-Wayne County Health Authority is an unprecedented collaboration of government, health providers, and the community. As a leader in this partnership, Henry Ford is working to improve access to quality health care for more than 700,000 people in the area who are uninsured or on Medicaid.
Goals of the Wayne County Health Authority are, number one, to provide everyone a medical home so that they have access to primary care. Secondly, to maximize reimbursement that's available through a combination of state and federal government programs. And third, to coordinate the care among the various provider organizations. The community has never really totally gotten its act together on this issue until now, and we're finally got everybody on the same page.
With the support of Henry Ford Health System, City Year Detroit meets the needs of youth in Detroit's lowest income neighborhoods by engaging young adult volunteers to tutor and work with this vulnerable population.
Literacy is the issue that our corporations, our foundations, our school districts, our parents, our community members, if you ask them to rank all the issues affecting Detroit, they would list the schools as the #1 issue.
One of the core members, Beth, she's in a kindergarten classroom, and she's brought so much enthusiasm to those kindergarten students about learning their ABCs and their numbers.
After a year of tutoring, the children who have the City Year tutor, as compared to the children who do not, are 1 year ahead in grade level.
Henry Ford's school-based health initiative addresses health disparities among Detroit's children through a network of school-based health centers that handle nearly 20,000 student visits each year.
They talk to me and tell me what can I do to stay healthy and be better, get my asthma better to where it needs to be.
Not only do you have the opportunity to teach that student that would probably not have come to you and would have continued going to the emergency room for their asthma, you have an opportunity to teach them more about their asthma. You know that you can also have the same opportunity to bring their family members in who also may be struggling with the same conditions.
For children and their parents who have experienced the death of a loved one, Sandcastles provides a safe environment to share experiences, learn coping skills, and support each other on their grief journeys.
If you talk to your friends, they always call, saying, "Why are you crying?" and stuff, and then they get mad because I keep on crying. But here, if I cry, nothing will happen because they know how it feels.
It's the people that really make it, the people who are in the group, and the facilitators just put that all together in the way that it just works perfectly.
I just feel that the program has given my son back to me in many ways.
There's no more recognition you could get than to get the Foster McGaw Award for community service. And we're very proud of what it means to the organization and to the community.
We very much appreciate the recognition because it does allow us, I think, to highlight and hold up and recognize the many people who, day and night, have made this organization able to contribute in a very meaningful way in so many disciplines and so many different programs for our community who we care so much about.
There's an important lesson for all of us in the Henry Ford story. A hospital or health system is a cornerstone of its community. People not only depend on it for health care and health improvement, but as a beacon of stability and hope as well. So congratulations to the entire Henry Ford team and to all the 2004 finalists for leading the way to a healthier America.
The Baxter International Foundation, the Cardinal Health Foundation, and the American Hospital Association congratulate the 2004 Foster G. McGaw Prize winner, Henry Ford Health System, Detroit, Michigan. We also honor the finalists: Harlem Hospital Center, New York, New York; St. Francis Medical Center, Grand Island, Nebraska; St. Joseph's Candler, Savannah, Georgia;